Hey guys, today we're going to be doing a cardiovascular assessment and also a respiratory assessment. So first you want to introduce yourself as a student nurse, and then you want to check your two identifiers, so first name and last name and date of birth. And then you're going to want to make sure that your patient knows what you're doing and you have consent from them. So to start off, you can ask them some questions. So do you smoke? How's your diet? Do you eat mostly whole foods or processed foods? Have you been out of breath lately, or any pain or numbness and tingling? And also if you participate in any sports, and etc. So first I'm just going to start off with the cardiovascular system, and then osculating. I do not have my stethoscope, so we're just going to point out the regions for you. First, at the third intercostal on the right side is the aortic valve, and you're looking for a clear lub-dub sound. If you hear any whistling or blowing, that might indicate something wrong with the valve. And then you move across from the chest. On the left side is the pulmonic valve, and then downwards is Erb's point, and then the tricuspid valve, and then the mid-clavicular. Just below the breast is the mitral valve, and then here is also the point where you listen for the apical pulse. So if it's regular, you would count for 30 seconds and times it by 2, and if it's not regular, you would count for the whole minute. And then also you will want to check for a pulse and evaluate whether if it's strong or weak, and if the rhythm is normal. And then moving on to the respiratory system, you want to check during breaths if it's even, if it's regular, if it's shallow, or if he's using his exterior muscles. And then you would palpate to check for any abnormalities in the back, so any weird bumps or lumps, and also in the front, just along his rib cage. And then also osculating with the stethoscope, you start from apex, and you would want to move across the chest, comparing the size, listening for wheezing or crackling or popping. And then you would want to move down, listen, and compare the side across, all the way down the rib cage. And also the sides, so starting from the top side, comparing the side over here, moving down along to the back. So also the back, starting from the top, and then moving across, and then down, across, down, across. You might want to do about 10, and each time telling the patient to breathe in deeply. Turn around again. Alright, and then also doing the expansion, turn to the side. Expansion, so place and pinch a little, and then take a deep breath in for me, please. And you're just looking for even elevation and breath intake. Okay, looks even, that's great.